Finally, the solution for senior healthcare services is here. SeniorMedicareBenefits.com, your healthcare connection, announces Grumpy's Guide to Senior Life. Starting with Video 1, what you may or may not know about Medicare Part A hospital insurance. Let's get started. What is Original Medicare? Original Medicare is Part A, hospital insurance, and Part B, medical insurance. Part A will be covered in this video. Who provides Original Medicare? On July 30th, 1965, President Lyndon B. Johnson made Medicare law by signing H.R. 6675. Medicare is sponsored by the federal government. What does Part A, hospital insurance, Original Medicare cover? In-hospital care, skilled nursing facility care, nursing home care, as long as custodial care isn't the only care you need, home health services, and hospice care. What are Part A Original Medicare costs? Medicare Part A hospital insurance costs are Part A monthly premium. Most people don't pay a Part A premium if 10 years total of Social Security contribution requirements are met. If you don't get premium-free Part A, you pay up to $413 each month. A hospital stay in 2017, you pay $1,316 deductible for each benefit period, $0 for the first 60 days of each benefit period, $329 per day for days 61 to 90 of each benefit period, $658 per lifetime reserve days after day 90 of each benefit period, up to a maximum of 60 days over your entire lifetime. In a skilled nursing facility stay, 2017, you pay $0 for the first 20 days of each benefit period, then $164.50 per day for days 21 to 100 of each benefit period. Then you pay all costs after the first 100 days of each benefit period. How do I qualify for Original Medicare? Most qualify at age 65, unless conditions exist for special enrollment. Original Medicare requires a total of 10 years of contributions into Social Security, and you are automatically enrolled and will receive Original Medicare Part A only with no monthly premium while covered on the Medicare program. How do I qualify for Original Medicare if I did not contribute 10 years into Social Security? If you do not contribute 10 years into Social Security, you may be required to pay part or all of a monthly premium. In 2017, the Part A Medicare premium is $413 per month. Part B premiums are separate. If you don't have enough credits with Social Security, you may qualify for premium-free Part A services on the work record of your spouse, provided that you are 65 or older and your spouse is at least 62. In some circumstances, you may qualify on the work record of a spouse who is deceased or divorced. Following the overthrow of the Defense of the Marriage Act, those in a same-sex marriage can also qualify on their spouse's work record if they live in a state that accepts same-sex marriage or recognizes the laws of other states that do. What are my options if I do not buy Original Medicare Part A? If you do not buy, qualify, or enroll in Part A when you are first eligible, you may have a penalty when you do enroll. You can enroll in Part B without having Part A. You can enroll in Part D prescription drug coverage without Part A if you're enrolled in Part A or Part B. And if you are enrolled in Part A, you are required to enroll in Part B. Is there a late enrollment penalty for Original Medicare Part A? If you aren't eligible for premium-free Part A and you don't buy it when you're first eligible, your monthly premium may go up 10%. You'll have to pay the higher premium for twice the number of years you could have had Medicare Part A but didn't sign up for it. Here's an example. If you were eligible for Part A for 2 years but didn't sign up for it, you'll have to pay the higher premium for 4 years. Usually you don't have to pay a penalty if you meet certain conditions that allow you to sign up for Part A, during a special enrollment period. What is a original Medicare Part A special enrollment period? Once your initial enrollment period ends, you may have the chance to sign up for Medicare during a special enrollment period, also known as an SEP, which are: if you're covered under a group health plan based on current employment, you have an SEP to sign up for Part A and or Part B anytime, as long as you or your spouse or family member, if you're disabled, is working. Or you're covered by a group health plan through the employer or union based on that work. You also have an 8-month SEP to sign up for Part A and or Part B that starts at one of these times, whichever happens first: the month after the employment ends, the month after group health insurance based on current employment ends. Usually you don't pay a late enrollment penalty if you sign up during an SEP or special enrollment period. What is a Part A Original Medicare benefits period? A benefit period is the way the original Medicare program measures your use of inpatient hospital and skilled nursing facility services. It begins the day you enter a hospital or skilled nursing facility and ends when you have not received inpatient hospital or Medicare covered skilled care in a skilled nursing facility for at least 60 days. In a benefit period, if you are admitted back into the hospital within the 60 days from your release date from the hospital, you are considered to be in the same benefit period, even if it is for a different illness than what caused your initial Medicare Part A benefit period to begin. Here's an example. If you are hospitalized for 7 days and start a benefit period and are released, the benefit period will begin the day of your release date and for the next 59 days to prevent starting Part A costs over again in case you are readmitted in that same time frame. In a benefit period, if you are admitted the day after your benefit period ended on the 61st day and beyond into the hospital, then it will be considered to be a new benefits period and your out-of-pocket expenses will start all over again. On days 61 to 90 of the same benefits period remaining under care, you will be responsible for $329 per day. On the 91st day, you have a 60-day maximum of lifetime reserve day benefits at a cost to you of $658 per day in 2017. Why are Part A and Part B Original Medicare very important? You are not allowed to enroll in a Medicare Supplement health insurance plan or Medicare Advantage health insurance plan without being enrolled in Part A and Part B Original Medicare first. This concludes Grumpy's Guide to Senior Life, Medicare Part A Hospital Insurance, sponsored by SeniorMedicareBenefits.com. Finally, the solution for senior healthcare services is here. Catch everything at SeniorMedicareBenefits.com.